everybody, this is Dr. Madiha Saeed, board certified integrative holistic family physician, coming to you live from my office here in Naperville, Illinois. So Thursdays we have been talking about those factors of inflammation, how your chronic symptoms are due to the underlying root cause of inflammation. And targeting this root cause can not just help one symptom, but all of them simultaneously. I know, so crazy. So we have been talking about how the gut health is one of your big, because 70 to 80% of your immune system lies in the gut. And so normally your gut bacteria, your gut lining should be like this. So depending on different factors, like the foods that you eat that we talked about, gluten, dairy, processed foods, artificial foods, anything, even sweeteners, and dairy, all of these things can cause and sugar can cause these channels to open. Chronic stress, infections, all these things can cause these channels to open, letting things through that should not be getting through, and killing off those good bacteria. And so the bad bacteria obviously are not doing their job well, so it goes, when things start to get through that should not be getting through, that then leads to something called increased intestinal permeability and leaky gut syndrome, and that then can cause inflammation, because if that inflammation goes to your brain, it can cause depression. If it goes to depression, anxiety, schizophrenia, bipolar. If the inflammation goes to your heart, it can cause heart problems. If the inflammation goes to your joints, it can cause joint pain. If the inflammation goes to your, to your skin, it can cause eczema and, psoriasis. So all these things that it could cause. So what's really key is that now we had been talking about all of those specific factors, specifically with food, that can lead to leaky gut. We need to now get a clearer picture. Now, because the only way to properly treat this dysbiosis, which is when your microbiome is off balance, is to first remove the problematic foods, the bad bacteria, yeast, parasites, anything that could be considered infections that elude the radar of conventional medicines and conventional tests. But that doesn't mean you have to actually fly blindly, because you can also get lots of tests done to know exactly what foods there are. I have to warn you, I don't normally check this in my labs because a lot of people have financial restraints, and I'm a bargain shopper, so that's the way I work. So there are tests that that have been around for decades, that can help at least guide you. But my philosophy is that where I start most of my patients is I start them off with the cheapest option, and that is a good history. It is important to listen to your body, to have, to make sure your symptoms sound like leaky gut, or do they sound like something else. So trust your instincts, trust your gut. I start people on just a very simple, just get them off of the main things that can cause a lot of problems. Then what I do is, if they want further testing, or if we get into a roadblock, or they're complicated cases, you can get stool tests that can check for what kind of bacteria you have. There's a wheat zoomer test that can also check to see if you're allergic to gluten and has a leaky gut test. Genova Diagnostics has some of these tests. And then, so there's a lot of Salvio. There's a lot of testings out there that can test for leaky gut, and SIBO, small intestinal bacterial overgrowth, is another thing that I have people check. They're testing specifically for that. Also, specifically, now that we mentioned SIBO, which is small intestinal bacterial overgrowth, a lactose breath test or a hydrogen or methane breath test can check for that. And I know that Genova has one, and there are a lot of other labs that have that to make sure that you don't have small intestinal bacterial overgrowth. But again, talk to your physician, talk to your practitioner, and then you can decide what is best for you. After that, another test that I do recommend often is I check food sensitivity testings. And those food sensitivity testings can be done. There's lots of labs that do them. And it checks both, and it's not the conventional test that you get done at the doctor's office where they just put like prick you, because that is mostly IgE related responses. This blood test that I get is IgG mediated responses. IgE and IgG. And there's probably about like 300 things that you could test to know exactly where your sensitivities may lie. Because if you take all those sensitivities out, your gut can heal a lot faster. The other testing that I do, again, I do this more so, later on in the process, is I do check for infections. That is a blood draw that your lab can cover. And I also, for chronic infections like Epstein-Barr, toxoplasmosis, there are hepatitis, herpes, all of those chronic infections that can be leading to some of your symptoms, that can check. Then we have your heavy metal testing and nutritional eval to know what kind of nutritional deficiencies you have. That can also check to see if you have an MTHFR deficiency, which is an enzyme that, or it's an enzyme that, MTHFR is like a gene malformation. If you have a gene problem, then your body doesn't work properly, it doesn't detox properly because it makes faulty enzymes that causes problems, it doesn't allow you to detoxify. So sometimes, I know for example the Nutri-Eval from Genova also has all of these things in it. But again, there's 23andMe that can check it. So there's a lot of other testings out there that can check for genetics testings, along with your so through the actual Nutri-Eval, you can check your deficiencies. There's a heavy metal testing to see if you're heavy metal, if you have any toxins in your body, and what specific toxins you do have and what's causing you problems. And then we talked about the gene testing. Again, I don't do these on a regular basis. Not everybody that comes to my office gets these testing, and that's the difference between me and other practitioners. I like to start off with the basics because a healthy lifestyle is key to recovery with anything. A healthy lifestyle will help improve your food sensitivities. A healthy lifestyle, because it'll heal your gut, and so you'll start to, especially if you take those out, heal your gut, and then you can start adding those things back in. A healthy lifestyle will start to improve your nutritional, because your body will be able to absorb some of those nutrients in. So where you start off with a nutritional eval and where you end up with is really different, because now that we're putting the fire out in the gut, what happens is that now you can start to actually absorb some of the foods. Yay! And that's where you have the energy, you start feeling better. Overall, your hair is better, just the skin's better. Why? Because of the fact that now your body's actually absorbing the nutrients you're putting in. And your money's not just going to waste down the toilet, literally. So once you heal your gut, all of these symptoms, you start, especially when you start eating more vegetables, you improve your detoxification. But again, there are situations where you'll need extra testing. So when you go to your practitioner, make sure you talk to them about what those could be, how much they'll cost, and it's always good to start off with the basics first and even going to that depending on your current individual situation. If you guys have any questions, we are going to go talk about starting to heal the gut. Yay! In the next couple of videos now. So because we had talked about what it was, all the things that can bother it. Now the testing, we just finished that up, and the next one is how to fix it. Yay! So join me next week, you guys, and have a great and blessed week. And again, please share and like this video so we can spread the message of hope and healing to the world. Along with, this is so exciting, you guys. My book is coming out in 2 weeks. I'm so excited. Yay! So remember, get the message out there because it's healing and the world needs hope. So, love you all. Talk to you soon. Have a great weekend.